Have you ever wondered why it seems harder to maintain balance as we get older? Have you noticed that movements that you used to do without thinking now require more concentration and effort? You're not alone. Many older adults experience these changes, but their underlying causes and how they affect our daily lives are rarely discussed. Did you know that the loss of proprioception is a key factor in this process? This video will explore why older adults lose balance and how this seemingly simple change can have serious consequences for their health and well-being. Make sure you stay until the end, because I am going to give you a short exercise routine with a step-by-step guide so that you can radically reduce the risk of falling in daily life. Cause of falls number 1. Damage to proprioception. Proprioception, or the body's perception of its position and movement in space, plays a crucial role in our ability to maintain balance and perform everyday activities safely. With aging, several factors contribute to the decline of this vital ability. According to studies, the loss of sensitivity in sensory receptors in muscles and joints is significant as people age. These receptors, known as mechanoreceptors, include muscle spindles and Golgi tendon organs, which send information to the brain about body position and movement. With age, the efficiency of these receptors decreases, which can result in a reduced ability to perceive movement and position, increasing the risk of falls. In addition to changes in peripheral mechanoreceptors, aging significantly affects parts of the central nervous system involved in the regulation of balance and proprioception. Two critical structures in this process are the cerebellum and the basal ganglia. Cerebellum. This structure of the brain is essential for the coordination of voluntary movements, maintenance of balance, and posture. The cerebellum processes information received from the senses, including proprioception, and adjusts movements in real time. With age, structural and functional changes can occur in the cerebellum, including the loss of neurons and decreased neural connectivity, resulting in less coordinated movements and compromised balance. They contribute to the inhibition of excessive movements and the facilitation of desirable movements. Degeneration in the basal ganglia, which can be exacerbated by neurodegenerative diseases such as Parkinson's, affects the ability to control movements fluidly and accurately, which can also contribute to instability and falls. Implications and management strategies. Given the impact of aging on proprioception and balance, it is essential to adopt proactive strategies to manage these changes. Interventions may include strengthening and balance exercises. Exercise programs specifically designed to improve muscle strength and proprioception, such as Pilates, yoga, or Tai Chi, can be especially beneficial for older adults. Neuromuscular rehabilitation. Therapies that focus on improving mechanoreceptor function and neuromuscular coordination can help restore some lost ability and reduce the risk of falls. Regular medical evaluations, periodic checkups that include neurological evaluations, can early identify signs of degeneration in the cerebellum and basal ganglia, allowing for early interventions. Falls in older adults are not only frequent, but are also a public health problem of great impact, especially given the seriousness of the consequences they can entail. Statistics show that globally, falls are the leading cause of accidental death and serious injury in people over 65 years of age. This age group has a greater susceptibility to falls due to natural decline in physical function, reduced vision, loss of proprioception, and other factors related to chronic conditions and polypharmacy, use of multiple medications. Among the most common and serious injuries that can result from a fall are hip and wrist fractures. Hip fractures in particular are notoriously problematic due to their impact on the individual's mobility and independence. A study published in the Journal of the American Medical Association reveals that approximately 20% of older adults who suffer a hip fracture die within the following year due to related complications, such as infections, circulatory and cardiopulmonary problems, which worsen due to forced immobility after the injury. In addition to fractures, falls can cause traumatic brain injuries, TBI, which can be especially devastating. TBIs can range from mild concussions to more severe injuries that can result in behavioral changes, cognitive dysfunction, and in extreme cases, death. Research indicates that brain injuries are responsible for a large proportion of the long-term morbidity associated with falls. The impact of a fall does not end with physical injuries. Psychologically, the fear of falling again can have a paralyzing effect on many older adults, often leading to a cycle of decreased physical activity. This fear can lead to decreased participation in daily and social activities, which in turn leads to increased isolation and, paradoxically, an increased risk of falls due to decreased physical strength and mobility. A study in the Journal of Geriatric Physical Therapy found that up to 29% of older adults develop a severe fear of falling after an initial fall, underscoring the need to address both physical and mental health in this population. Given the severity of falls, prevention is a critical component of healthcare for older adults. This includes strengthening and balance exercises, such as Tai Chi or yoga, which have been shown to be effective in improving balance and reducing the incidence of falls. Cause of falls number 2, medications. Additionally, it is crucial that older adults be regularly evaluated by healthcare professionals to adjust any medications that may affect their balance and review any underlying medical conditions that may increase the risk of falls. The impact of a fall can extend far beyond physical damage. For many older adults, a fall not only means a hospital and recovery period, but it can also bring with it a fear of falling again. This fear can lead to a reduction in physical activity, which paradoxically further increases the risk of falls by decreasing muscle strength and flexibility and affecting balance. Polypharmacy, or the use of multiple medications simultaneously, is a common practice among older adults, especially those managing multiple chronic conditions. However, this approach can have unwanted side effects, including those that affect balance and stability, increasing the risk of falls. Understanding the interaction of these medications and their impact on the health of older adults is crucial to mitigating these risks. One of the most common side effects of several medications that influence balance is orthostatic hypotension. This medical term describes an abrupt drop in blood pressure that occurs when rising from a sitting or lying position. Symptoms may include dizziness, blurred vision, weakness, and in severe cases fainting or falls. This phenomenon is particularly concerning for older adults because their ability to regulate blood pressure may be impaired due to age or underlying illnesses. Medications such as antihypertensives, which are used to control high blood pressure, can contribute to orthostatic hypotension. Likewise, some types of antidepressant and antipsychotic medications can also have this side effect. Additionally, diuretics, which are often prescribed to treat heart failure and other conditions, can alter fluid and electrolyte balance, which can also lead to orthostatic hypotension. Interactions between different medications can exacerbate side effects and increase the risk of falls. For example, combining sedatives, antidepressants, and narcotics may increase sedation and decreased alertness, further compromising stability and balance. A detailed analysis of an older adult's medication regimen may reveal medication combinations that potentially contribute to an increased risk of falls. Health professionals should regularly review these regimens and consider deprescribing, which is the process of reducing or eliminating medications that are no longer necessary or that may be harmful as part of the comprehensive health management of older adults. To minimize the risk of falls due to the interaction of multiple medications, it is essential to take a proactive, multidisciplinary approach that includes regular evaluation by doctors, pharmacists, and other health professionals. These evaluations should focus on medication review, periodic evaluation of all medications the patient takes to identify those that may contribute to orthostatic hypotension or negatively affect balance. Patient education. Inform older adults and their caregivers about the possible side effects of medications, especially in terms of how they may affect balance and risk of falls. Monitoring and adjustments. Adjust medication doses when necessary and closely monitor the patient's response, especially after changing or introducing new medications. Promoting healthy lifestyles. Encourage activities that improve strength and balance, such as yoga or Tai Chi, which can help mitigate the risk of falls despite the challenges presented by polypharmacy. Cause of falls number 3. The vestibular system, located in the inner ear, plays a crucial role in maintaining balance and spatial orientation. This system includes 3 semicircular canals that detect rotary movements and 2 organs, the saccule and the utricle, that perceive linear movements and changes in position with respect to gravity. Each of these components is filled with fluid and contains hair cells that are activated by the movement of the fluid, sending signals to the brain about the position and movement of the body. Deterioration of the vestibular system with age. With age, the vestibular system can undergo a series of degenerative changes that affect its function. These changes may include the loss of hair cells and decreased fluid viscosity within the semicircular canals and otolithic organs. As a result, the precision of signals sent to the brain decreases, which can lead to imbalance and inaccurate spatial orientation. This degeneration is a common reason why older adults experience balance problems, especially when changing positions quickly or when moving in dark or irregular environments where visual information is not sufficient to compensate for vestibular deficits. Meniere's disease. In addition to normal aging, certain pathological conditions can exacerbate balance problems related to the vestibular system. One of these conditions is Meniere's disease, a disorder of the inner ear that significantly affects balance and hearing. Although the exact cause of Meniere's disease is not completely known, it is believed that it may be related to an imbalance in fluid pressure within the inner ear. Impact and management of Meniere's disease. Episodes of vertigo associated with Meniere's disease can be particularly debilitating and can last from minutes to hours, with a significant impact on the individual's quality of life. Management of Meniere's disease may include low-salt diets to help regulate fluids in the inner ear, the use of diuretics, and, in more severe cases, surgical treatments that can range from injecting medications to procedures that alter the anatomy of the inner ear or selectively destroy parts of it. Intervention strategies. For older adults who suffer from deterioration of the vestibular system, whether due to aging or conditions such as Meniere's disease, interventions may include vestibular rehabilitation therapies. These therapies are designed to help patients adjust to the loss of vestibular function and improve their balance and stability. Specific exercises can help train the brain to more effectively use other sensory signals, such as visual or proprioceptive signals, to compensate for vestibular deficiencies. Appropriate understanding and treatment of vestibular problems are essential to improve the safety and quality of life of older adults, allowing them to maintain greater independence and reduce the risk of falls and their associated complications. These biological changes are combined with external risk factors and lifestyles. For example, a diet poor in essential nutrients can negatively affect bone and muscle health, increasing the risk of weakness and therefore falls. In addition, a sedentary lifestyle contributes to the loss of muscle mass and strength, crucial factors in preventing falls. From a prevention perspective, it is essential that older adults and their caregivers are informed about how healthy lifestyle habits and certain home modifications can significantly reduce the risk of falls. The implementation of grab bars in strategic places, the use of appropriate footwear, and the elimination of obstacles in hallways and rooms are simple but effective measures. A well-structured exercise routine can be very beneficial in improving balance in older adults, helping to prevent falls and improve quality of life. Here I present a complete and detailed exercise routine that can be done at home with little or no equipment, designed especially to strengthen balance abilities. Heating. Duration: 5-10 minutes. March in place. Raise your knees alternately, keeping your body upright. Do this exercise for 2 minutes to increase your heart rate and prepare your muscles. Arm circles. Extend your arms laterally and make small circles, gradually increasing the size. Do this for 1 minute and then change direction. Waist twists. Place your hands on your hips and gently twist your torso left and right, looking over your shoulder with each twist. Perform 10 turns on each side. Main exercises. Duration: 20-30 minutes. Heel-toe raise. Holding onto a chair, raise your heels until you are on your toes, then slowly lower yourself down. Repeat 10 times. Then, lift the balls of your feet to rest on your heels and return to the starting position. Do 10 repetitions. Flamingo walk. Holding onto a chair, lift one leg, balancing on the other for 10 seconds, then switch legs. Do 5 repetitions per leg. The side lunge. From a standing position, take a side step with one leg and bend your knee to a 90-degree angle, keeping the other leg straight. Return to the starting position and repeat on the other side. Do 5 repetitions per side. The chair. Without a chair, simulate the act of sitting, lowering yourself as far as possible without losing your balance, and then getting up again. Do 10 repetitions. Stand on one foot. Try standing on one foot, holding onto a chair if necessary. Hold the position for 10-20 seconds and then switch feet. Do 5 repetitions per foot. Cooling and stretching. Duration: 5-10 minutes. Calf stretch. Facing a wall, put one foot forward and keep the other back, both feet flat on the floor. Push against the wall until you feel the stretch in the calf of your back foot. Hold for 30 seconds and switch legs. Quadricep stretch. Standing if you need to. Hold a chair for balance. Bend one leg and try to bring the heel towards the buttocks, supporting the foot with your hand. Hold for 30 seconds and change legs. Neck twists. Relax your neck with slow twists to the left and right, looking over your shoulder with each twist. Do 5 repetitions per side. This routine not only helps improve balance, but also contributes to overall flexibility and strength, crucial aspects for health and autonomy in old age. It is always advisable to consult a doctor or physical therapist before starting any new exercise routine, especially if there are pre-existing health concerns.